MBI has provided a lot of confidence. It's sort of our sweet spot study in our center. The negative predictive value is extremely good for MBI. It approaches that of 97 to 98%. So if a woman has a dense and very complex mammogram, it's hard to flush out what's going on with traditional imaging. MBI really answers that. We found that our breast surgeons really like MBI. It's an easy test to understand. The results are very helpful. Many are using it for preoperative staging or planning when MRI is not an option. As we gained more confidence in MBI, we decided that we would now use it as our primary supplemental screening for women with dense breast tissue who are not high risk. Basically, our workflow starts at a point where we have a mammogram that's normal but dense or complex, and we're uncomfortable with the fact that we might be missing something. The next thing we want to do is evaluate the patient's risk level, and if they're a high-risk patient, they're going to go on to breast MRI. If the patient is not high risk, we're going to send them on to molecular breast imaging. It makes me feel great on one level because I know I'm providing a service very few other places have. On the other hand, I feel very frustrated that a lot of other people aren't doing this because it can fit in virtually into most practices without much effort at all. Before, we might have had to turn to MRI, which is much more expensive, time-consuming. But now with MBI, we can do it rapidly and in a real-time fashion, and this provides a great environment for the woman to get her results quickly, and if we have to do something, act on them quickly. MBI has had a significant impact on our local healthcare expenditures. We're doing far fewer unnecessary biopsies. Our false positive rates have really dropped a lot. The cancers we're catching with MBI are invasive, they're small, and they're node negative. And those are cancers that are much less expensive to treat. For those embarking on an MBI program, I would take two things to heart. It really works, and it makes breast imaging much more pleasant than if you're using screening breast ultrasound, and even MRI. Those are complicated examinations to read. Going forward with the program, you're going to find it really easy to learn, very easy to use, and it's going to make your practice much better.